Hello, everybody, and welcome to The Art of Healing with your host, Dr. Judy Jasek of Animal Healing Arts and Matt Rowe of ParsleyPet. During our show, we are talking about your pet's health, raw feeding, and alternative treatments for cancer, unexplained illnesses, and supporting your pet's natural ability to heal. Welcome, Dr. Judy, to this week's show.
Thanks, Matt. Always happy to be here.
Oh, this one's going to be fun. We're going to be talking about elevated liver enzymes because it's really a predominant issue today with our pets is that these elevated liver enzymes, you'll hear it, you'll see it talked about. Maybe your dog has even been under that elevated liver enzyme warning from your veterinarian, or at some point been kind of that it's brought to your attention that we should pay attention or pay a closer look to this. So when we talk about elevated liver enzymes, what is one of the causes of it, or why would my pet get an elevated liver enzyme? I'm feeding them everything that I think that is right to feed my pet at this time.
I think that probably the most common cause is inflammation. So if you think about what the liver does, the liver processes and helps detoxify. It helps detoxify the body. So it processes toxins. So the more things we're putting into the body, the more work the liver has to do. And if any of those things are potentially toxic, i.e. side effects, so any medications, vaccinations, flea and tick preventatives, if you do those types of things, heartworm prevention, all of these things cause the liver to work harder, and we're going to see elevated liver enzymes. So it doesn't mean that the liver is sick or not functioning properly. It may just mean that the liver is working really hard, and I think that's the case oftentimes, especially if the pet is healthy. So like one thing I see fairly frequently actually is like young pet will go in for a spay or neuter, and we do the pre-surgical blood work, and liver enzymes are elevated. Where on earth did that come from? Because the pet seems healthy, and then they can't have the surgery, and then they're told they need to go on a special prescription diet and a bunch of supplements. And I think that what happens in the young dogs, if they've had a lot of vaccines, again, they're getting heartworm or any other medications. If they're eating a kibble diet, you're going to have an inflamed liver. It's just, there's so many inflammatory ingredients and potentially toxic ingredients such as glyphosate, just as we've talked about, that having an inflamed liver on kibble is almost guaranteed, even if it doesn't show up on the lab work.
Yeah, because if you're thinking about it, everything your pet is eating is getting processed through the liver, all the nutrients, minerals, everything that you have. And then all of a sudden, if I'm feeding it a high carbohydrate based diet that equals sugar, something my dog is not meant to digest, then it's hitting my pet's liver that is probably not used to processing sugars like our livers are as human beings. And so now we have restricted, if we're feeding kibble, we're not feeding a raw based diet the way that our pet is meant to be fed. And now we're feeding it this high sugar, high carbohydrate that is processed through the liver, which I know anytime I eat something bad, my stomach hurts. It's just my stomach inflaming. And so really, how does that, it's going to go through the liver at some point too. And of course, with this high inflammation, liver enzymes quickly follow.
Right. And I've also found that dogs with GI upset, like say they go, dogs are scavengers, they eat stuff, get into the garbage, eat something that they normally wouldn't. They have a little vomiting and diarrhea, and they go in, and sometimes they run blood work. I can about guarantee you they're going to have elevated liver enzymes. I have seen dogs with, like bad diarrhea just from something they ate, and do blood work. They have sky high liver enzymes. And what I see sometimes happen is these pets are then committed to, or told that they should be committed to feeding a prescription liver diet for the rest of the pet's life. And really, all we need to do is treat the GI disease, because again, the liver is processing whatever the dog got into, and in a couple weeks, liver enzymes come right back down to normal. So I think when
Yeah.
we have a spike like that, and the dog's been healthy up to that point, we really need to be rechecking those enzymes and making sure that they're staying elevated before we say, oh, this dog has chronic liver disease of some sort.
Sure. So with that, so if let's say I go into the vet, they tell me Leo has elevated liver enzymes, do I panic?
No, you don't.
Do
You
I?
don't need. Yeah, you
Yeah.
don't need to panic. First of all, look at the pet. How's your pet feeling? Is he eating? Does he have normal stools? Does he have good energy? The liver is a very essential organ, and if we have serious liver disease, we're going to have a sick pet. Like in the case of something like a shunt. Now, a shunt is where the circulation, the normal circulation to the liver, does not form properly. So the blood doesn't go through the liver. So the liver actually can't do its job. The liver is not able to help detoxify the body. And so the
Okay.
liver we're going to see some elevated liver enzymes and actually other signs of toxicity in the body, such as encephalopathy, which is a big word, which means that the brain is inflamed because the liver can't detoxify. So you'll see neurologic symptoms after the pet eats. But you're going to see if there is serious liver disease, you're going to see some sign of illness in the pet. If the pet is acting perfectly normal, then it's not that we don't want to do some support. We might want to do some herbs such as milk thistle, dandelion, things that can help support the liver. I have some Chinese herbal formulas that I use to help improve blood flow. Sometimes, like in older pets, if the liver's been inflamed for a long time, we actually have reduced blood flow going into liver, and I can use Chinese herbs to help open up that blood flow and help the liver to function better. There can also be a seasonality. It's interesting. This is from a Chinese medicine perspective, but sometimes like the liver will do different things in the spring as in the fall, and there might be different herbs that are necessary. So if you see a spike at certain times of the year in the liver enzymes, then that can be a sign that we need to change gears and maybe do a little something different with the herbs. So I think what's really important to remember is this isn't cut and dried. Oh my gosh, we have elevated liver enzymes. Conventional medicine likes to name things, put things in boxes, and then they do like a one size fits all treatment plan. So we have elevated liver enzymes. We're going to do this prescription diet and maybe a supplement or two. And that's all they have. Whereas in more holistic and natural medicine, we're going to do some things for liver support, and then we're going to continue to monitor, and we're going to see if those enzymes normalize. And actually, I've even seen where, maybe we don't get the liver enzymes exactly into the laboratory normals, because the laboratory normals are averages, typically based on kibble-fed dogs. And maybe one certain pet we don't quite get the liver enzymes into that quote unquote normal range, but maybe that's not normal for that individual pet. And we have to look at the whole animal and how are they feeling. And we probably would want to do like an ultrasound to look at liver size and structure just to make sure it doesn't look like there's something else going on. But I think it's okay if the enzymes are up just a little and they stabilize. What we don't want to see is we don't want to see them spiking, or we don't want to see them 5 times the normal range. Then, I would definitely be intervening if I saw an extreme elevation.
Okay, so really you're looking at it as a case by case basis and starting to take a look at everything. So the whole picture of it, from how does the pet look? How is it acting? How is it, is it more of a chronic case? Is this is this just a singular event because they ate something bad? So by discovering that type of stuff, you're not saying that there is this one size fits all modality for healing it, which is prescription dog food, which is scares the tar out of me because they've seen in prescription
Hmm.
dog foods where they have actually less nutrient and mineral quality than an actual conventional dog food. So they've just stripped some pieces out of it. So really, but you're still feeding kibble, which is an inflammation. And so you're still causing that element of inflammation into it. So then it begs me to ask the question, does raw feeding, can that help support a pet during elevated liver enzymes, or do you recommend not doing raw feeding when a dog has elevated liver enzymes?
Oh no, I absolutely recommend it. Pretty much,
Mhm.
unless the dog won't eat raw, there really is no time that I wouldn't recommend a raw diet. We might balance it a little differently in
Yep.
in certain cases, but we're talking fresh food. Some older pets maybe don't digest it quite as well, so we might go a little with a lightly cooked or maybe a dehydrated, but absolutely a fresh food diet, because we have to remove the inflammation, and
Mhm.
kibble's all inflammatory. If you're feeding
Mhm.
kibble, you're inflaming your pet's body, and it's going to show up one way or another at
Mhm.
some point. And sometimes it's good that we see these elevated liver enzymes, because we know, okay, hey, we need to make some changes.
Mhm.
If we don't see, it manifest in the lab results, well, the pet's still inflamed. We're
Mhm.
just not getting the warning signal, and sometimes until it's much further down the road and we have much more serious disease.
So really, if I go in with Leo and shows elevated liver enzymes, instead of panicking, it's treated as a red flag. It's saying,
Right.
okay, what are the habits? What am I feeding my dog? What are they getting into? And you brought up like glyphosate. Like, am I walking Leo in a place in a field that had been recently sprayed? Where am I going? What am I doing? And what toxins am I introducing in the environment? Now, did I go and have vaccines done recently? Did I, in the kibble diet, that if you're feeding a kibble diet, should you take a look at feeding a raw based diet and starting that journey towards raw feeding and really treat it as that red flag as it should be? So if that's a red flag, if Leo goes in, it's a red flag. When should I show elevated concern towards those elevated liver enzymes?
I would say if they persist or if they continue to go up. So an
Okay.
otherwise healthy acting dog, like you took Leo in and we
Mhm.
got some elevated liver enzymes. And the other thing is they're transient. He could be reacting. Blood work's always a snapshot. It's that
Right.
point in time. And,
Mhm.
and these enzymes are dynamic. So
Mhm.
maybe his body is just reacting to something that particular point in time. So
Mhm.
I would do some gentle support, maybe some
Yep.
dandelion, milk thistle, support the
Mhm.
liver 2 to 3 weeks, we recheck the enzymes. They
Okay.
may come down, we're done. We don't need to worry about ongoing liver support. So like, well, he got into something. If
Right.
they stay elevated or they continue to go up, then I would probably do an ultrasound. I'd want to take that
Okay.
physical look at the liver. Ultrasound is great because it's non-invasive, outside of maybe shaving a little bit of hair. And we
Yeah.
can get a good idea, is the liver normal size? Is it normal?
Mhm.
Is the architecture normal? You can tell a lot more from ultrasound than you can from an x-ray and a soft tissue organ like the liver. X-rays are great
Yeah.
for bones, but ultrasound's much better for the soft tissue organs.
Mhm.
And so you get a closer look. And then, from that, we make a determination. Well, maybe when we want to do a little more targeted support, like
Mhm.
some Chinese herbal formulas or things that are targeting specific patterns in the body. And then we would look at the whole routine. I always ask
Mhm.
what supplements are pets on. Sometimes
Mhm.
pets are just on so many supplements.
Yep.
And when I see persistently elevated liver enzymes, we'll stop anything that's not
Mhm.
medically necessary. The
Yep.
dog's, has a history of seizures and is on an anticonvulsant. Now, those can make the liver enzymes go up as well, but we're not going to pull them off of those cold
Right.
turkey. But any supplements that we can stop and to see
Yeah.
sometimes just taking those things out of the routine, just again, it's just
Mhm.
giving the liver less work to do,
Mhm.
sometimes can help. Another thing I recommend too is say, the pet's on 3 or 4 supplements that, we would consider beneficial, but you can rotate them. Don't give everything every day.
Yeah.
Like do one for a few days, then give another one for a few days,
Mhm.
kind of cycle through them so they can get the benefit of those supplements, but
Yeah.
we're not making the liver work quite so hard.
Mm. Yeah. Because I mean, you think about everything that goes in at some point, whether it's a supplement, food, environmental toxins, anything that enters the body is making the liver work.
Right.
So let's say I'm feeding kibble and I'm like, oh, yeah, I don't want to feed raw. I'm just going to feed kibble, but I'm going to give these incredible supplements to my pet. And you give them 3, 4, 5 different types of supplements, and they're all natural, organic, like the best and the best of the best. But each one of those is making my liver work. So at some point, if I continue from what I hear you're saying is, if I'm continuing this pattern where I'm regularly giving, then all of a sudden I may be giving an over amount of actual supplement that I actually want. So I'm going past the beneficial aspects of it. And I'm getting it to an elevated state again, which aka is causing that liver to work twice as hard.
Right, exactly. And if the dog's eating kibble, you're not addressing what is most likely the biggest underlying cause of the elevated liver enzymes in the first place. So if you're giving something that's insulting the liver, all the supplementation in the world is not going to make up for that.
Yeah, that's a really good point. I know if you watch the show, if you're a regular watcher, we talk about kibble as being a major cause of a lot of things that kind of come in. And whether it's a cause or not, we just know the ingredients. We know what's in it. We know how they make it. And we know that your dog cannot digest it. It just really just wreaks havoc on the internal structure of your dog, from the stomach lining to the liver to the kidneys, to all of these pieces that come into your dog living this happy, healthy life. Kibble is just something that satisfies their hunger, but never really addresses their health.
Yeah, and I'm really to the point in my practice that if I have a new client come in and they're not willing to go with a fresh food diet of some sort, whether it's raw or lightly cooked or maybe a dehydrated, I can't work with them because nothing I do is going to be effective if we're feeding that kibble diet. It's just not. So the other options, and I just know how damaging kibble is to the body. And the other things I do, we're just not going to have success on pets eating a kibble diet. And so I think people just need to take that step. And that's the most important step, whether it's supporting the liver or any other system in the body. You've got to get them on the fresh food diet, get them off of the kibble. That's just the single most important thing you can do.
So on a success story, we did a show on pancreatitis, I think a couple of weeks ago. And so there was a woman that is in the office that we have, and she was saying that her dog had pancreatitis, extreme 12-year-old dog, a lot of pain. And so really, we started to talk about, she watched our show and she started to explore raw feeding and put her dog on a dehydrated based raw food, prime food. And so, and it was a start for her to start getting into the actual raw feeding movement. So this dog was not wanting to go for a walk, was under a lot of pain medication. As you know, pancreatitis is extremely painful. And so you're looking at, she had all of these supplements that she was giving. So when we just recommended, she ended up starting to give CBD for the inflammation. And then she started to take a look at, she did stick with some inflammatory medicine because she said it helps, some over the counter, but she flipped to this raw diet. And she came into the office this week and showed me a video of this weekend of her dog playing again. And the
Cool.
dog had never played in the last 6 months. The dog hadn't played. And so when she was looking at, she goes, and on another good note, my dog slept. She goes, it was regular over the last 6 months that my dog would wake me up 2, 3, 4 times a night to go back out to the restroom or to actually, I think, just need to some help with the pain that her dog was experiencing. And she goes, for the last 2 weeks, my dog has slept through the night in the it's poop has started to form solid again, has gotten away from diarrhea. So you're seeing this transition live happen in regards to just supporting your dog's natural ability to heal.
Yeah, that's amazing. That's just a great story, and it just exemplifies the power of eliminating the kibble. I mean, that's the biggest thing. I'll work with people on what form of fresh food feeding they're most comfortable with, and sometimes we need to ease the pet into it because it is a change.
Yep.
But once you remove those inflammatory ingredients, they just do so well, and especially something as potentially serious and even life-threatening as chronic pancreatitis and painful. Those dogs just hurt, and it messes up their whole digestive process. And then look, this is what, a 12-year-old dog, and
12-year-old.
acting like we just took 5 years off its life because
Yep.
we changed the diet.
Right. And that's great. And for you and I, it's not crazy. This is just what we know and we've experienced and we live it every day. So now going back to elevated liver enzymes to close out the show today. So when Leo gets diagnosed with elevated liver enzymes, what do you think my first step should be?
I would say I would do some gentle herbal support. So you can get dandelion, milk thistle, dandelion root and leaf, both are very, very supportive of the liver and kidneys, and the milk thistle. Also, so those two things I love for like gentle support. I would do that for a couple of weeks, and then recheck the liver enzymes and see if they're staying persistently elevated. And then if they're persistently elevated, then I would probably do an ultrasound, and then maybe do a little bit of additional support as needed. And I know that you feed Leo raw. So, I mean, the very first thing, if you weren't feeding a raw diet, would be to, get him off a kibble. But I know you're already doing that. But on a kibble fed dog, the very first thing would be to come off the kibble, and then do that gentle herbal support and monitor. It is really important to keep an eye on these things. We want to make sure they're coming down and make sure they're not staying persistently elevated or going up.
Yep. That is incredible. Well, thank you, Dr. Judy, for this week's show. So what's the best way for anybody watching to get a hold of you?
Well, you can check out my website. My practice name is Animal Healing Arts, and my website is ahavet.com. Our email is info@ahavet.com, and our phone number is 720-515-2421.
And I highly recommend you reach out to Dr. Judy. She can do a telemedicine approach. And if you're not in Denver, Colorado, and let's say you're in Boston and you're like, oh, I'd love to have just a quick 15, 20 minutes with Dr. Judy and talk about what's going on, engage in a telemedicine with Dr. Judy. She does it very well. So thank you so much for being on the show today, Dr. Judy. And if you ever want to know what nutrients your dog needs or where the minerals inside your dog may be deficient or over elevated, engage with ParsleyPet. Have a nutritional blueprint conducted. And I can tell you, and we can tell you, just from a quick sample, 1 tablespoon of their hair, we can tell you where you're feeding them the best way or where you need to adjust their diet to achieve that optimal health that we want for all of our pets.
And check for toxins that could impact the liver as well. So
on a scary side, we just tested a dog that had elevated mercury levels. Now, the number that we saw where it's safe is anything below 0.4 milligrams, percentage milligrams per billion. We want to see it below 0.4 on mercury levels. This dog had a level of 2.6.
Wow.
So, and was experiencing extreme seizures. And we're starting to diagnose the dog with epilepsy. And after the test, our vet, Dr. Kozier, basically said, this dog does not have epilepsy. This dog is being poisoned with mercury. And so that was something that is, we could get ahead of that. And that's some of the great things that we see with ParsleyPet, that we just get, yeah, be able to help that puppy out to stop the seizures and slowly begin removing the mercury out of its system and stop where it's actually getting mercury, is just really why we do what
Yeah, that's great. It's just so
we do.
important to find that out.
Mhm. So I want to thank everybody for watching the show today. This is we have another one next week, and definitely stay tuned Wednesdays at noon um, for the art of healing. So thank you so much, Dr. Judy, for being on the show. And we'll
Thank
talk
you,
to you soon.
Matt. Oh, always a pleasure.
All right, we'll see you soon.
Okay, bye.
Bye.